rapid access to comprehensive oncology data and survival analysis. This is the Enko Toolkit.
You're in a busy clinic. You have to make a critical call on treatment eligibility, but the guidelines are buried in some PDF, and your assessment has to be standardized, fast, and, well, defensible. Let's solve that. So, what if you could just collapse hours of digging through dense guidelines into a few seconds? This is all about moving from that cluttered, manual assessment to an instant, streamlined, and totally evidence-based ECOG score. It's built to cut down on clinical risk and, maybe most importantly, give you back your time. Okay, let's get into the real clinical challenge here. The fundamental problem we're all trying to solve is pretty simple. How do we get away from these subjective, eyeball judgments and move to something that's standardized and reproducible when we're assessing a patient's functional status? This is the dilemma at the heart of so many of our conversations, isn't it? Does our patient really have the functional reserve to handle aggressive therapy, or is pivoting to palliative care the right call? We have all seen it happen. Relying on gut feelings can lead to really inconsistent decisions. And that's why a standardized scale like ECOG is so important. It creates a common language for the whole multidisciplinary team, making sure we are all completely aligned on a patient's functional limits. And the stakes, they are incredibly high. The research is crystal clear on this, especially highlighted in this quote from that landmark Prickerson study. For patients with metastatic disease, chemo given too close to the end of life can actually lead to a worse quality of death. That is the exact outcome we are all working so hard to prevent. So now that we've established the why, let's really dig into the what. Before we even touch the software, it is absolutely essential that we understand the clinical science behind the ECOG score itself. This is the evidence that drives every single calculation in the tool. So the ECOG performance status, as you see it defined here, is a pretty simple 0 to 5 scale that measures a patient's functional impairment. Its whole purpose is to guide prognosis and treatment decisions. And it isn't just some arbitrary thing. It's grounded in that landmark 1982 paper by Oaken and colleagues. That study established the evidence base we still rely on today. And this table right here, this is the gold standard. This is the official reference that links every single ECOG grade to its therapeutic implications and the patient's physical capability. This is our source of truth for every assessment we make. All right, let's break this down into really actionable tiers. First up, you've got the low-risk tier. We're talking grades 0 and 1. These are patients who are largely active, and for them, standard full-dose treatment is usually the right call. Now, the really critical cutoff is ECOG 2. That puts the patient in the intermediate tier. Here, they're ambulatory for more than half the day, but they can't work. That's a huge signal for us. It means increased toxicity risk, and we should start thinking about dose adjustments. And finally, you have the high-risk tier for grades 3 and 4. In this case, the patient is confined to a better chair for more than half the day. For a grade 3, aggressive therapy is often contraindicated, and by the time you get to grade 4, best supportive care really becomes the standard recommendation. So, we've gone through the clinical science. Now, for the fun part. Let's see how Enko Toolkit completely automates this whole workflow, turning all those complex criteria into a clear, instant result. It all kicks off with these simple, intuitive inputs. You're just selecting the patient's observed physical ability, their level of confinement to a bed or chair, and their capacity for self-care. It's designed to be totally unambiguous, just clear clinical observations. And boom, in seconds, there's your result. Based on what we put in, the tool calculated an ECOG grade of 1. Right away, this places the patient in that low-risk tier we just talked about, which suggests that standard treatment is likely the appropriate path forward. And this next step, this is absolutely crucial. Transparency. We don't believe in black boxes. As you can see right here in the logic panel, the primary source from Oaken et al. Is cited, and the formula's logic is explicitly laid out. You can always see exactly how the score was derived. But the usefulness of this tool doesn't just stop with one patient encounter. Now, let's look at how it bridges the gap from the clinic to creating really powerful, actionable data for your research. With every single calculation, you can save the result. And what's really powerful is this Export All to CSV button. With just one click, it pulls together your entire session into a clean, structured data file, a perfect, research-ready dataset. And it's really important to understand that this is a dedicated research workflow. The export function is designed exclusively as a bridge to your academic work. It never interacts with EMR, which ensures you get a clean, structured data set that's ready for statistical analysis without any of those data cleaning headaches.
Now, this exported data doesn't just have to sit there. It actually feeds directly into a broader ecosystem of research tools, all designed to take you from that raw data all the way to discovery.
The workflow is a simple two-step process. First, you run your data through the CSV polisher. This tool automatically cleans everything up, handles missing values, and gets your categorical data into the right format. Then, second, you just upload that polished CSV directly into our survival analysis tool. And this brings us full circle. The data that started as just a quick clinical assessment is now fueling automated chi-square analysis, generating Kaplan-Meier curves, and calculating hazard ratios. Basically, all the components you need for a publication-ready survival analysis. So the final question really is this. With a workflow that so seamlessly integrates clinical assessment with powerful data analysis, what are the critical research questions that you could finally answer?